Ozempic Face. What do you mean about Ozempic Face? Here's Ozempic pre, and on the right is Ozempic post. So basically with Ozempic Face, one of the things that you're seeing is you're seeing the hollow temples, the very gaunt eyes, the wrinkles, and then the draping jowls, as a result. Now, I've done a lot of videos on Ozempic in the past. You can go back a couple of years, you can watch those. If someone asked me, what are your thoughts on Ozempic for weight loss? This is my short answer is, well, it's chemical anorexia. Anorexia is a medical term for loss of hunger. Basically, what it's doing is it's just chemically causing something inside of your body to cause you to not be hungry. And it does a lot of other things too, which it causes delayed gastric emptying, known as gastroparesis, which is why it keeps your stomach fuller for a longer period of time. But basically, it's just chemical anorexia at this point. If you look at this right here, you'll notice that this individual has a lot of excess skin. Okay. So you might call this like a belly apron or something like that. Has a lot of excess skin around the belly, has also a lot of excess skin around the breasts. But I want you to think of this. If you gain a lot of weight, that's going to cause your adipocytes or your fat tissue to expand. And so when you start losing weight, then those adipocytes or those fat cells start to shrink. But if it causes your skin, because of the expansion of those fat cells, causes your skin to start to stretch, well, skin only has so much elasticity. And then when it starts to shrink down, then there's nothing to fill in those areas. And now you got saggy skin, saggy jowls, wrinkles on the neck. So this is why this not only can happen in the face, but it can happen in any part of the body that has expanded due to long-term fat deposition. So this is why this can happen when it comes to Ozempic. But you're saying, yeah, but doc, I lost weight. Congratulations. You ate less. You are probably protein deficient because protein helps to support the skin, specifically collagen. And it also is why there's so many people saying I lose so much muscle on Ozempic, because it's just because of how it works with the stomach. You can't consume adequate protein. Now, you're also probably deficient in a lot of nutrients as well. The weight loss experts are now recommending a special GLP-1 agonist multivitamin. Now they're saying, here's your multivitamin for your GLP-1 support. I'm like, you should have just had liver or taken a desiccated liver. That's nature's multivitamin. If you look at the average American is overfed, but they're undernourished. Why I say this: eat meats and veggies, nuts and seeds, some fruit, little starch, and no added sugar. Keep intake to support exercise, but not body fat. A lot of people, they've dug themselves a hole and they're just not willing to dig themselves out of it. Consistency is always the key. Don't tell me what you're going to do. Show me what you've done over a long period of time.